Well, I was 4 months pregnant. I just discovered I was pregnant and I was in a panic. I didn't have insurance and didn't know where to go. I worked with a friend of mine who was also pregnant, and she told me that a mutual friend of ours worked here and that when she was seen, she wasn't required to have insurance. And that was my biggest fear, was coming to a doctor and getting this insane bill or trying to qualify for insurance and not qualifying because I didn't know what the requirements were. I was super nervous at first. It was my first time being pregnant, my first time really just having that type of women care, period. I was diagnosed with cholestasis with my son. With the cholestasis, I had to be seen once a week and then twice a week, which I became very familiar with the staff here. And then they just became family because they were so used to seeing me. Went from nervous to loving this place. It's like almost like a second home. I always heard that when you had state insurance that you just didn't get the quality care that you needed. And so I was super surprised when I came here because what type of insurance I had didn't matter. After everything I've been through with my 2 pregnancies in 2 years, I tell the world, I tell every single pregnant woman that I see that if you're not coming to Great Lakes Bay, then you're not coming to the right place. My life is in a completely different place. I am so happy, so blessed to have my 2 kids, my amazing man, soon to be husband, and just loving life.
Oh, I hit rock bottom real bad. No job, broke, drinking all the time. Just didn't care about life anymore. Till I came to the Ruppin Center. Just they opened my eyes that there was still a world out there. Finally went in to see for a checkup because a lot of stuff was going wrong. My doctor also told me we can have somebody else will be here for you emotionally. And she said, I want to introduce you to a lady named Miss Connie. So I said, if you think it'll help.
My role as a community health worker is to help patients help themselves, get the resources that they need that are available to them in the community.
She's like a saint walking on earth. She fought tooth and nail, helped me out, got me medicine when I didn't have nothing, when I had no money, nothing. She went above and beyond what I could have ever expected a human being to do for another person. You know, especially somebody like me. Body was just like breaking down. I was in not only an emotional wreck, but just also a physical wreck. Overweight, bad. With my doctor, Ms. Harrison, she hit me on every level, so she's making sure that, you know, the eating is going to be good. She cared about how I honestly felt inside, not just physically.
Ruben was struggling with wanting to work. He wanted to work. He had elderly parents at home that he was taking care of and wanted to know what he could do. We gave him the tools. He did the work. He got the job. He has health insurance. He has gotten his blood sugars under control, just doing phenomenal, and he did all the work.
Ever since I've gotten healthy through the doctors and my social worker, life has been great. I mean, having a thriving career. See, these people care. They deep down, they generally care about you. It's not about the dollars and the bills or how much they're gonna make off you because they're seeing you and treating you for this. Ain't nothing about that. They care. I'm living proof. They care. I want to be there. I can't stress that enough. I would not be here if it wasn't for the Ruppin Center.
I never took the time to go see my doctor to check myself out. I didn't too much care about it because I was more focused on taking care of my kids, providing for my kids. The symptoms started when I was over at my friend's house and we were just laughing, talking, and the only thing that I remember saying is, I can't breathe, blacked out. Woke up in the ICU and I'm just looking around and I heard the nurse was like, well, good morning, sunshine. And when she said that, I was trying to say good morning. I was like, where's my voice? Where am I? I had to learn how to walk, talk, eat. Once I got the talking under control and the walking and the eating, it was like, okay, what's the next? My goal for my MyCare program was depression. I didn't want to look in the mirror because when I look in the mirror, it was that reminder of me being in a hospital because of my trait. I was ashamed. I didn't grasp the fact that I got to learn how to love myself with the trait.
So a patient is eligible for the MyCare team if they have a chronic condition such as diabetes and hypertension and depression and or anxiety. So we have enrolled 716 patients in the program to date, and we're excited to be extending that program for even longer than initially to help more patients.
I got over the depression. My second goal is my weight. Trying to get back to me. MyCare, they call me, they text me about the walking club. So me walking, I'm like closer of my goal of losing weight. I'm making friends. I'm enjoying life. I'm laughing. What keeps me coming? The nurses, the therapists, the psychologists. They actually genuine care about my well-being, trying to show me ways of doing things in a healthy manner. I feel radiant. I feel great. The dark cloud it moved away, you know what I mean? So I feel great on top of the world.